I've had the privilege of knowing these two international treasures, I might like to add, for a number of years now. And we met both of them for the first time in 2014 at the New Jersey Lyme disease conference, where we were all speakers, and along with my son. My son and I are both survivors of severe Lyme disease, chronic Lyme, I should say. So I'm Dr. Jodie Dashore. I'm the director of BioNexus Health Clinic in Marlborough, Monmouth County, New Jersey. My clinical practice is completely dedicated to tick-borne diseases and comorbid conditions associated with Lyme disease. I've been a Lyme-literate naturopathic practitioner utilizing plant-based treatment options for almost a decade now. I see patients of all ages, severely debilitated, lives turned upside down, childhoods and livelihoods lost because the disease went unrecognized and became chronic. My then 6-year-old son was in a wheelchair with excruciating pelvic, hip, and leg pain for 1.5 years, and we actually had 10 false negative Lyme tests, which were run. We did not know about any specialty labs. We had Harvard orthopedic surgeons on board. We had Yale physicians, immensely wonderful and knowledgeable doctors, and we did run the really sad and pathetic national test, which is the ELISA and Western blot, and we had 10 false negatives, all different kinds of scans, and in the end, everybody gave up and said, you know what, Dr. Dashore, perhaps it's time to see a pediatric cancer specialist. It makes me emotional even now, but I look back and I thank Dr. Charles Ray Jones in New Haven, Connecticut, that we were referred to him, and he saved my son's life, and he saved pretty much my life, because I discovered that Brian's Lyme disease was not only acquired, it was most probably also gestational, from what I learned from mentoring with Dr. Jones in New Haven. So, unfortunately, adequate targeted treatment, fortunately, I should say that unfortunately, adequate targeted treatment became a game changer for us. Some of the cognitive issues that we had resigned ourselves to in my family, those changed as well. And I'll be giving you one little case study to further illustrate. So, unfortunately, once the disease becomes chronic, what happens is multiple organ systems are affected. And the physical, emotional, most importantly, the economic burden on afflicted families is vast. Lyme disease treatment is very expensive. Most physicians or Lyme specialists are not able to accept insurance. There just isn't, it's just not possible. Some do, of course, some do. And God bless them, but there's often tragic consequences of all of these various issues that come along with Lyme disease. New Jersey has a large population of people diagnosed with Lyme disease, and here's the key, a large number diagnosed with autism spectrum disorders. Okay, now over 65% children with autism that I see in my practice test positive for Lyme disease. The improvements that are seen in these children after being treated for Lyme disease is mind-boggling. It is something that the parents have accidentally stumbled upon, and I have spoken at international autism conferences, International Autism One conference every year, and it's just the awareness is growing, and many children on the spectrum are benefiting from proper treatment, and we see improvements. We know that any improvement brings a lot of change, a lot of benefit to a family dealing with autism, often with multiple siblings, not just one child. I recall one case, 7-year-old Lucas from Manalapan, of course the name's been changed, was diagnosed with autism at 5.5 years of age. Now that was odd in the first place, and he was followed by a slew of diagnoses like ADHD, sensory integration, oppositional defiant disorder, with escalating neuropsychiatric symptoms. He was trying to commit suicide. He was trying to murder his little brother. He was eating chemicals from under the kitchen sink. Long story short, mom found me because she heard about my experience with my own child and that he was recovering at that point, my son. So detailed evaluation, in-depth history, and whatever testing was available. I think we did go through IGeneX for Lucas. Turns out that he had acquired Lyme disease and 4 co-infections. Right when he was 4 years old, he had a tick behind his ear, and then when he was 5 years old, he had a tick behind his neck. It was attached for a few days, and it was deemed, oh well, it needs to be attached for a week for it to give you Lyme disease or something of that sort. Absolutely ridiculous. So this child, today, the good news is, Jake, after being treated, actually Jake was his younger brother. Lucas, after being treated, has been mainstreamed. He's getting good grades in school. He has lost his autism diagnosis, and through my mentorship and research, I also learned that Lyme disease is known as the great imitator. So it is, once again, I use the term mind-boggling because can you even imagine autism being a symptom, not necessarily a syndrome on its own, when someone has severe Lyme disease? So that was Lucas's story, and Jake had a similar story, but both of them are doing really well right now. It is a nationwide crisis, in fact, a global pandemic of sorts, just like Dr. Smith mentioned. Patients often travel far, and they have to wait for months because most Lyme specialists are booked up. I myself am unfortunately booking into February now, and I've treated patients from over 40 countries, providing in-person and virtual guidance to helping them. Whoever were able to obtain visas, they came over, but the others, I mentored them virtually online along with the local doctors in that region, and it's been great. We have mentorship Zoom meetings, virtual video conferences every couple months, sometimes every couple weeks. We discuss cases. I've been asked to speak abroad. I'm going to London, UK next month to speak there again as well. Due to the immune suppressive nature of this illness, and due to the fact that the Lyme spirochete has multiple life stages, there just isn't a spirochete form. All of these life stages need to be addressed for a full remission. Treatment is complex. Relapses are sadly all too common. There is a critical need for research into developing reliable tests, methodology for early diagnosis, increasing awareness, and targeted treatment of various strains and life forms of this illness. Most people, just like Dr. Smith said, acquire numerous co-infections like Bartonella, Babesia, Anaplasmosis, Rocky Mountain spotted fever, Powassan, tularemia, etc. All in all, early intervention is key, and it leads to an overall greatly reduced socioeconomic impact as well. That's my opinion.